This week the Health Secretary Jeremy Hunt was forced to apologise after 55,000 non-urgent surgeries were postponed to February. Labour's shadow Health Secretary Jon Ashworth was quick to criticise the government's record on the NHS But Andrew Marr snapped back at the Labour Party frontbencher, pointing out that his party were in charge of the NHS in Wales, which was also struggling. He said, "So ministers are responsible. Can you remind me who is in charge of the NHS in Wales?" BBCAndrew Marr pointed out to Jon Ashworth that the Labour Party were in charge in Wales. The Shadow Secretary admitted on the Andrew Marr show that a Labour government was running the NHS in Wales. Marr then asked when was the last time in Wales that the NHS met its air targets. Before the Labour MP sidestepped the question, Mr Ashworth said, "The NHS in Wales is under pressure, but they have not cancelled operations like we have had to do in England." Marr pressured the Labour MP, demanding his question was answered, as Mr Ashworth attempted to point out issues with the NHS in England again. Marr raged, "You are in charge of the NHS in Wales," the Labour Shadow Secretary said. "Well, I am not personally in charge, but when was the last time the NHS in Wales was given a sufficient level of funding? Remember, this is a government that is cutting the money across the board and is giving tighter financial settlements to the health service in England and in Wales." Mr Ashworth also claimed that if there was a Labour government power of the country, more money would go into the NHS in both England and Wales, helping to resolve current problems. Jeremy Hunt was forced to apologise earlier this week after the operations were postponed to free up hospital staff and beds. The Tory politician told Sky News, "We recognise that it is better if you are unfortunately going to have to cancel or postpone some operations, to do it in a planned way." Thursday, February 9, 2017. "Can you remind me who is in charge of the NHS in Wales?" Andrew Marr. "So that's why this year we've decided to take this decision, or this independent panel has decided to take this decision, and that I think in the end is better for people, although if you, as someone whose operation has been delayed, I don't belittle that for one moment, and indeed I apologise to everyone that has happened to." In a statement, NHS England said that the panel discussed sustained pressure over the Christmas period with high levels of respiratory illness, high bed occupancy levels, signs of increased flu activity, and a rise in the number of severe cases attending air. Sir Bruce, NHS England National Medical Director, said, "I want to thank NHS staff who have worked incredibly hard under sustained pressure to take care of patients over the Christmas. We expect these pressures to continue and there are early signs of increased flu prevalence. The NHS needs to take further action to increase capacity and minimise disruptive last-minute cancellations. That is why we are making these further recommendations."